At Reserve Health Marathon Health, we work with public safety officials. This includes police and firefighters. When we do these occupational health screenings, we do annual tuberculosis screenings based on the risks to our officers and firefighters that are working out in the field. Every year we'll draw a blood test called a quantiferin gold. The quantiferin gold is a blood test that looks for proteins related to tuberculosis. If this test is positive, then it means the individual has been infected with tuberculosis, but the results may be different based on the individual's symptoms. So if a person is symptomatic, then they're considered someone who has active disease. Active tuberculosis is something we can identify through a chest x-ray and based on symptoms, along with a positive quantiferin gold test. If the quantiferin gold test is positive, but the person does not have symptoms and does not have any indications on their chest x-ray, then that individual may be considered latent tuberculosis, or they may have been treated for tuberculosis in the past. So when we do these blood tests, we will review what the results are, and then we'll discuss with the patient to determine if they're at risk for active tuberculosis or latent tuberculosis. In most cases, it's latent tuberculosis. For those individuals, we will refer them to their primary care clinic to be treated for latent tuberculosis. That's going to be medication that they take over the course of 3 months. For individuals that are at risk for active tuberculosis, we'll work with them to refer them to the health department. Those individuals will be asked to wear personal protective equipment and to isolate away from their families. The majority of our patients will not go through that protocol. Our goal at Reserve Health is to screen annually for tuberculosis so we can identify it when it's a latent infection instead of active disease.